ampules, then sa yang atbang ato is our emergency meds. So first, ari sa ta sa emergency meds, then after sa akong discussion, i-incorporate pod ni Ate Plo ninyo ang radiographic agents o ang loose tablets. It's part man na siya sa Cabinet 5. So first, we have the classifications for cardiac drugs. So sa ako ang report, ang importante lang is kabalo mo kung unsay ang category, kay if kabalo mo unsay category, mas easier man iyang action. Dayon, kuan lang, don't overthink ra kaayo about sa kanang deep in discussion sa exams kay if the more na tong mo supplement ko og hatag og informations about MOAS and everything, basin maglibog na niya mo. So, ang kuha lang is kung dapat kabalo ra gid mo asa specific ang function sa usa ka drug para dili na mo maglibog. And of course, ang pinaka-importante gyud ang iyahang classification. So, first we have the cardiac drug. So, we have amiodarone. So, with the brand, Cordarone and Ritma. So, familiar na mo ani tanan no? So, ito ang amiodarone, we have the Cordarone and Ritma. So, amiodarone is a class 3 antiarrhythmic indicated for the treatment of recurrent hemodynamically unstable ventricular tachycardia and recurrent fibrillation. So, when you say classes, ka-familiar pa ba mo sa mga inyong classes of antiarrhythmic drugs? Familiar pa ba or na-retain pa ba ang mga classes of antiarrhythmic drugs?
Yes, ma'am.
Or
Yes, ma'am.
familiar pa? Sige. Unsa man ang kuan, ang tawag ani? It's not the function. Primarily, unsay function? Sige, functions atong class 1. Unsa man ang class 1? For it inhibits, unsa man? Sige, sumpay ko, it inhibits
Sodium channel ba?
fast sodium ion channel. So, very good. So, class 1. So, dili ra ko mo deep in ha. Ang ako na is maminaw mo dayon para ma-refresh na pud mo kay kabalo na mo ani and na-discuss na pud ni siya. So, for class 1, it inhibits the fast sodium ion channel. So, ang class 1, pwede siya A, B, C, pwede dili mo deep in ana. So, for example lang, so, we'll cite an example for our class 1. So, we have the quinidine, we have the procainamide, the disopyramide, and the moricizine. So, part ana po, we have the lidocaine, the tocainide, and the mixilitine. And last is the flecainide and the propafenone. So, again, for class 1, I want you to highlight lang si quinidine, si procainamide, and si lidocaine. So, again, so for class 1, remember, it inhibits the fast sodium ion channel. So, give an example, we have quinidine, we have the procainamide, and of course, the lidocaine. Next, for class 2, unsa may function sa tong class 2? Sige, as a review, class 2, unsay class 2 gani? Unsay function ni class 2? Decreases the rate of, unsay ang i-decrease? Di ba naman ni siya katong mura og kuan diagram tong mo straight, mo up, ana discussed by Dr. Lobane. So, class 2 decreases the rate of
Depolarization, ma'am.
Okay, very good. So, it decreases the rate of depolarization. So, example, we have esmolol, propanolol, and your acebutolol. So, basta olol, that is class? Isa nga class?
Class 2, ma'am.
Okay, very good. Class 2. So, again, basta olol, you have class 2. It decreases the rate of depolarization. Next, class 3. It inhibits the potassium ion. Sumpay ko. It inhibits the potassium ion. Ha? Ang to? It inhibits
Potassium ion channel.
Okay, very good. It inhibits the ion potassium channels. Ay gang for a while sa agang ha kay nag-chat si Ate Plo, dili siya kasulod. Kadali lang ha, excuse ako ha. Kadali lang. Ako sa siyang kuanan. Sige. So for class saan to nga class ganita? So for class 3, it decreases class 3, it inhibits the potassium ion channel. So we have unsa to example sa class 3 ang unsa example sa class 3 gani? Okay, amiodarone. Okay, so amiodarone, we have the sotalol, ibutylide, dofetilide, and the beryllium. So, di ba, ang olol-olol is class 2, but except ni sotalol because sotalol is class, unsa nga class si sotalol? Class 3. So, again, for class 1, it inhibits the fast sodium ion channel. So, we have the quinidine, procainamide, lidocaine. For class 2, decreases the rate of depolarization. So we have the olol-olol except sotalol. So we have esmolol, propanolol, acetylbutalol. For class 3, it inhibits the potassium ion channels. We have amiodarone, we have the sotalol, ibutylide, dofetilide, beryllium. Then for class meal and the deltiazem. So, sa mga classes, ang available ra nato nga drug sa pharmacy is we have our lidocaine, we have propanolol, naatay amiodarone, and of course our verapamil. So, kana lang i-differentiate ra ninyo kung asa na sila na fall kay since we're talking about the emergency drugs naman so dili na ta kinahanglan sa ubang drug. I-remember na ninyo ha. Dili na jud ko mo hatag ra og kanang further discussions na gid ana. Ato ara is ma-review and importante kabalo mo kung asa ang ato ang drugs. If naatay drugs nga under na classification, kabalo mo kung asa siya na belong. Okay? Hindi lang ha, kay si Ate Plo nag-request. Okay. Sige. Gets ra? Gets ra?
Yes, ma'am.
Yes, ma'am.
Okay. Ingna ko ha, if pass-pass ako ha, ingna ra ko if pass-pass ko kayo. Okay, next, we have dobutamine hydrochloride. So we have the brands Dobusense, Dobuzef, and Centramine. So this belongs to a class of drugs known as inotropic agents. So treatment for cardiogenic shocks. Again, it belongs to the class of drugs inotropic agents, treatment of cardiogenic shock. Next, we have epinephrine. So epinephrine, cardiac stimulant in case of collapse, shock, and honest accidents. Again, cardiac stimulant siya in case of collapse, shock, and honest accidents. Then we have dopamine hydrochlorides with the brands Myocard, Dopabus, and Cardob. So ang brand nga Dopabus, which specifically bago pa lang ni siyang naabot, then we have Cardob previously pero karon wala tay Cardob. So mo ni atong brands atong dopamine before, Myocard, Dopabus, and Cardob. So treatment of cardiac therapy. So it is a purine, endogenous, again remember ha, endogenous purine nucleoside. Then we have digoxin or the brand Lanoxin. So this binds to and inhibits the sodium or potassium ATPase or the sodium pump with the plasma membrane of cardiac myocytes. So this inhibition increases the intracellular sodium content, which in turn increases the intracellular calcium content, which leads to wait, mura gabalik-balik siya. Sorry, gabalik-balik ang iyahang kuan. This inhibition increases the intracellular sodium content, which leads to increased cardiac contractility. and used in cardiac failure accompanied by atrial fibrillation, management of chronic cardiac failure where systolic dysfunction or ventricular dilations are dominant. So muna ato ang digox, since again, importante sa digoxin binds to and inhibits your sodium or potassium ATPs or your sodium pump nga sodium pump with the plasma membrane or cardiac myocytes. Then last, we have the isosorbide dinitrates or with the brand Isoket. So an organic nitrate, which is common with other cardioactive nitrates, a vasodilator used in severe or unstable angina pectoris, unresponsive left ventricular failure secondary to acute myocardial infarctions. Again, isosorbide dinitrate isoket for angina pectoris. A vasodilator used in severe or unstable angina pectoris. Okay. So, review ta ha. Again, kung sa ito itong cardiac drugs, we have amiodarone. This one amiodarone. Amiodarone.
Dobutamine,
Dobutamine.
Epinephrine.
Epinephrine.
Dopamine.
Dopamine.
adenosine,
Adenosine.
and
Digoxin and isosorbide dinitrate. So, kanang 7, muna siya ang atuang cardiac drugs. Okay? So, remember, kana silang 7, muna sila ang atuang para sa cardiac drugs for emergency medicines. Okay? Next, we have antidotes and detoxifying agents. So, another classification, we have antidotes and detoxifying agents. So, we have atropine sulfate, so an anti-choline esterase. Again, atropine sulfate, an anti-choline esterase. So treatment of bradycardia and asystole of various causes including acute CPR procedures, poisoning with mushrooms containing muscarine and organophosphorus pesticide poisoning. Again, for atropine sulfate, highlight an anti-choline esterase. Treatment for poisoning with mushrooms containing muscarine and organophosphorus pesticide. Okay, so that's for, more na siyang dapat i-highlight ni atropine sulfate. So, anti-choline esterase, then, kuan siya, treatment for poisoning sa ato ang mushroom and containing muscarine organophosphorus pesticides. Okay. Then we have the anti-asthmatic and COPD preparations. So for anti-asthmatic and COPD preparations, we have aminophylline. So with the brand, sa tong brand ni aminophylline gani, if naka-remember pa mo, kato ni siyang taason ng murag isoket, sa yung brand ni aminophylline, amino, sa atong aminophylline, since bisan generic ranking entry sa atong system, we have the brand Aminosol. So, a broncho again, a bronchodilator, xanthine derivative, non-selective adenosine receptor antagonist used as anti-anginal and anti-ischemic treatment. Again, aminophylline highlight bronchodilator, xanthine derivative, non-selective adenosine receptor antagonist, or an anti-anginal and anti-ischemic treatment. So, muna si aminophylline. Next, corticosteroids. So, specifically hormones. Atong corticosteroids, we have dexamethasone sodium phosphate. So, with the brands, Dexticort, Dexton, and previously naatay Cordex. So, marawa na mo kabot ni Cordex. So, muna atong brands ato ang dexamethasone. Dexticort, Dexton, o si Cordex. Pila ganay preparation ni dexamethasone atong ampule? Pila ka milligrams?
5 milligram per
Okay, very
ml, ma'am.
good. 5 milligrams. Then, naapod ta, before, naapod tayo 4 milligrams nga preparation, ana. So, munang careful mo, ana, atong dexamethasone, if ever, ang ang i-prescribe sa Picker-Slip kay nay usahay nga 4 milligrams ang ilahang i-prescribe. But sa una pa to, mga January, murag nawala na ang 4 milligrams nga preparation. Is Dexdecort, Dexton, and Cordex. So corticosteroid that prevents the release of substances in the body that causes inflammation. So period. Mura na siya ang description sa ato ang dexamethasone. Basta inflammation, na corticosteroid, that is your dexamethasone sodium phosphate. Okay. So next classification, we have diuretics. So again, common example for our diuretics nga meds, we have
Furosemide.
Lasix, ma'am.
furosemide,
Lasix, ma'am.
Lasix nga brand, and sa to nga brand pa, we have
Furosan.
Furosan. Very good. So we have Lasix and Furosan. So loop diuretic medication used to treat fluid buildup due to heart failure. So period. Dihara tama ato ang description ni furosemide, since if ato pa nang siyang i-dip in, mas lisod na siya kaayo and mas complicated. So again, as long as kabalo mo sa use ni furosemide as a loop diuretic. Then we have antihistamine or the anticholinergic. So classifications under antihistamine or anticholinergic, we have diphenhydramine hydrochloride. So natay generic entry nga diphenhydramine yun, and of course we have Sonifen. So perennial and seasonal or hay fever, allergic rhinitis, inhalant allergens, and habahin og allergies or para antihistamine na preparation for emergency meds, we have diphenhydramine. So take note lang ha, kay ang discussion with loose tablets, pare-pareha lang siya, so magbalik-balik lang siya kay usara man gid ta sa ato ang brands. So most probably na uban nga na balik na po sa discussion with the tablets. So most probably review na lang ang uban ani. So antihistamine, we have diphenhydramine. So common, we have diphenhydramine. Okay. Next, we have anticonvulsants. So for anticonvulsants for emergency meds, we have magnesium sulfate heptahydrate. Okay, again, magnesium sulfate heptahydrate indicated to acute hypomagnesemia accompanied by signs of tetany. Second, prevents and control of convulsions in patients with pre-eclampsia or eclampsia. So asa man kalimitan na makita ni mga pre-eclampsia or eclampsia gani pag unsay scenario or ang situation ni patient pag
Pregnant, ma'am, or like labor.
very good. So pag pregnant ang ato ang pasyente. So prevention, another use niya is for prevention of hypomagnesemia in patients receiving PPN. So kabantay mo usually sa atong second floor if naay ka ng mga pregnant. So kalamitan gina sila mo prescribe din na sila og magnesium sulfate. Again, inyo lang kitang dira ni magnesium sulfate for pre-eclampsia or eclampsia and treatment for hypomagnesemia. Next, we have phenytoin. So phenytoin, wala na taani since expired ang ato anang phenytoin. Wala pa nakasip. We have the brand Dilantin. But naatay isa to other preparations ni phenytoin or Dilantin aside from ampule na asad tay.
Tablet.
Unsa na ang preparation nato sa ampule? Ni phenytoin or Dilantin naatay. Unsa other preparations available nato? Naasa loose meds na atay capsule. Naka-familiar pa ba dito sa loose meds, phenytoin? Color orange? Nakabantay ba dito sa loose meds? Wala. Dapit sa sodium bicarbonate, Suprasid.
Wala tayo ka-dispense na.
Right? Wala kayo dispense. So, natay available under preparation aside from ampule or for IV, natay capsule ani nga available na asalos. So color orange ni siya na capsule. So an anti-epileptic used to control the partial and generalized tonic-clonic seizure. Again, highlight anti-epileptic used to control generalized tonic-clonic seizures. So, natay brand nga saccharin preparation is 1,000 or 5,000. So, again, for heparin, it inhibits the clotting by activating a type of blood protein called antithrombins. Again, antithrombin. So, mali siya nga to ang anti-clotting processes.
Ma'am, wala pa move ang slide, ma'am.
Ay, wala na mo pang slide. Wait lang. Basin mo ang slide. Kana lang. Wait lang ha. Hindi ako dyan. Wala pa dyan ako.
Ano na?
Okay. So, heparins, again, heparin, nata dito, kita naman mo ani nila sa dati sa may magnesium sulfate. So, it inhibits the clotting by activating the body's anti-clotting processes. So, again, one of the anti-clotting processes uses a type of blood protein, so that is called antithrombin. So, the antithrombotic effect of heparin is well tolerated in the inhibition of the factor Na. So, basta kabahin kung clotting, so we have heparin. Then, the alteplase, or we have the brand Actelize. So, this is indicated for the treatment of acute ischemic stroke. So, the human recombinant tissue type plasminogen activator. Again, the alteplase or your Actelize is a human recombinant tissue type plasminogen activator. It activates the fibrin-bound plasminogen endoplasmin, initiating the fibrinolysis and of thrombus or your fibrin clots. Again, Actelize, it is a human recombinant we have heparin and alteplase or your Actelize. Next, vasoconstrictors or your adrenergics. So common, we have norepinephrine bitartrate with the brands Norbit, Epinor, and Levoped. Another brand given is naa sa consignment, we have Nortix pod. So norepinephrine pod gihapon tao. So if low blood pressure ang antibiotics, we have the phytomenadione. We have the vitamin K, so aka vitamin K or the phytomenadione. So with the brand Cyclamen and Conacayon. So hemorrhage or threatened hemorrhage associated with a low blood level of prothrombin factor or your factor 7 and antidote to anticoagulant drugs of coumarin types. Again, highlight phytomenadione or the vitamin K as an antidote to anticoagulant drugs of coumarin type. So since gisgot naman laman ta og antidote, so ako na lang i-review. I-review na lang. So again, phytomenadione or vitamins. Next, we have electrolytes. So for our electrolytes, we have the sodium bicarbonate, we have the brand Solunate, and the Pfizer nga sodium bicarbonate. So for metabolic acidosis, again, pag inon gani nga sodium bicarbonate, kalamitan answer ang ana for metabolic acidosis. So during the intoxications, including the barbiturates, salicylates, or methyl alcohol poisoning and in hemolytic reactions requiring alkalinization of the urine to diminish nephrotoxicity of blood pigments. Again, kanang naay mga kinalang i-alkalinize. So, muna siya itong gamiton dayon ang sodium bicarbonate. So, metabolic acidosis highlight for sodium bicarbonate for metabolic acidosis. Next, calcium antagonist. So, we have Verapamil. So, the brand Isoptin. So, nataan ninyo sa kinalasan nga drawer, we have the Verapamil. So, for chronic stable angina pectoris, unstable angina pectoris, vasospastic angina pectoris, or your Prince metal angina. So, again, unsa to nga class si Verapamil? Class
4, ma'am.
Very good. Class 4 Verapamil under class 4 of anti-arrhythmic drugs. Okay. Now, for the next slide, incorporate na ko ang kaning gamay nga atong mga polyamps. So since it will be further discussed with fluids together with Ma'am Jennifer sa cabinet 9, but kuan siya, since under man pud siya gamay sa emergency med, so ako lang pud siyang i-highlight. So, isotonic. Isotonic, familiar mo ani? Isotonic. O sa gitong tulo man sa kabuok. O sa gito? First is isotonic. Second is natay isotonic.
Hypo and hypertonic.
Okay, very good. Isotonic, hypertonic, and hypotonic. Now, we will first discuss the isotonic. So when you say isotonic, a solution that has the same solute concentrations as another solution. So meaning there is no net movement of water particles and the overall concentration on both sides of the cell membrane remains constant. So when you say isotonic, no movement. So same ang iyang solute concentration as another sa iyang solution. So basta no movement, that's isotonic. So examples sa isotonic, sige guess, unsay possible examples sa isotonic solutions? Isotonic solution nga example we have nga naa sa emergency bed.
0.9 na sodium chloride.
Ha?
0.9 na sodium chloride, ma'am.
Okay, or our NSS nga polyamp. So very good. So isotonic example, possible example nato given is the NSS polyamp or our 0.9 nga sodium chloride. Next, hypertonic. When you say hypertonic, a solution that has a higher solute concentration than another solution. So mas taas ang iyang solute concentration. Water particles will move out of the cell causing crenation. So if move out causing crenation, that's hypertonic. Example,
Normal
we
saline.
have normal saline. Kanang kuan gang, example ra gang nga naa sa atong emergency meds lang. Katong dapit ni kuan. For example, we have the 50 water, we have sa palain aside
Potassium
the 50
chloride,
water.
ma'am.
Okay, very good. Potassium chloride. Kuan gang ha, kaning discussion ako sa isotonic, hypertonic, ug hypotonic. I-further discuss gid ni Ma'am Jen kay si Ma'am Jen na dito tanan iyang fluids. But kaning sa ako, please take note lang katong naa sa emergency meds ha. Gets ra? Mga gang?
Yes, ma'am.
Okay, katong
Yes,
lang naa
ma'am.
sa emergency meds. Kaya ako ra siyang kuan ra nako gamay ni touch ra ko og gamay but wala ra kay ko ni deep in gyud sa iyang discussions kay since yamay mo discuss gud ani mas daghan pa. At least, nanamoy gamay nga idea. In case mobalik ang kaninga question, so nanamoy idea with Ma'am Jennifer. So we have for hypertonic na atay D50 og si D50 og si ano ni? Kasi nga ano niya? Potassium chloride. So basta gani particles will move out of the cell causing cremation, so hypertonic. So when you say hypotonic, solution that has a lower solute concentration than the another solution, so water particles will move into the cell, so musulod, causing the cell to expand and eventually lyse. So if mo sulod ang water or ang water particles mo sulod sa cell, causing the cell to expand, so mudako siya and mubuto. So we have given example for hypotonic. Ako siyang gi-search since wala man tay available aning 0.45 nga normal saline. Kay ato kay 0.45 normal saline or what tay 0.45 katong violet 0.45 normal saline. Wait sa ha, normal saline ba to? Kadali lang ha. Para i-sure. Normal saline. Sodium chloride nga 0.45. Sino mo ano? Wala gid ita ani. Wala di ita. 0.45. So, more siya given example for hypotonic. So, again, since emergency meds lang ta, so, adto lang mo sa isotonic. So, again, isotonic, hypertonic, hypotonic. So, katong naa sa emergency meds nga mga polyamps nga naa dito nga part, please, kuan ka ng refresh lang. Refresh. If naay time before ma-exam, dool mo dito para malantaw kayo. So supposedly, this is part of my hard exam, sa hard part unta sa exam, but ako na lang siyang gi-storya para dili ra pud kaayo mo masyakira. Okay? So, na siya sa hypertonic, isotonic, more siya importante nga mahibalan. Okay? Next, move na ta ni sa ato ang ampules diring sa side sa PICA. So we have the calcium channel blockers or the antihypertensive. So first, we have the nicardipine or the brand Cardipine. So unsa gito preparation to nicardipine? Pila ka milligrams? We have
10 mg, ma'am.
10 mg og
2 milligrams, ma'am.
2 milligrams. Okay, very good. So for our cardipine, we have 10 and 2 milligrams nga preparation. So acts by blocking the influx of calcium ions into vascular smooth muscle and cardiac cells during depolarization. So again, for cardipine or nicardipine, action, calcium channel blocker. And that's, mura na siya, nicardipine, calcium channel blocker. Then we have again for hemostatics or the antifibrinolytics. So again, di ba nata hemostatics before but under man tong emergency meds. So sa dili emergency meds, we have the hemostatics or the antifibrinolytic. We have tranexamic acid with the brands Hemostan, Trenaxin, and Actronex. So dili ko sure if nakaabot mo ni brand ni Actronex kay kani dili lang po ni siya kaayo dugay. So natay brand, tulo na atong na brand ni tranexamic acid. So Hemostan, Trenaxin, and Actronex. So a synthetic derivative of amino acid lysine and binds the 5 lysine binding sites on plasminogen. So this inhibits plasmin formation and displaces plasminogen from the fibrin surface, and it acts by blocking the breakdown of blood clots, which prevents bleeding. So basta which prevents bleeding, we have tranexamic acid. Okay? Kanang nasa pinakaunang mga synthesis, that's kanang action na niya, but eventually, ang action drug yun ni, in short, action ni tranexamic acid, it prevents bleeding. Okay? Hemostan, Trenaxin, Actronex, tranexamic acid prevents bleeding. Next, we have the CNS stimulant or the neuroprotective agent. CNS stimulant or neuroprotective agent, citicoline with the brand Cholinerve and Zynaps. Again, citicoline, Cholinerve, and Zynaps. for cerebrovascular disorders including ischemic stroke, Parkinsonism, head injury, and increased blood flow and oxygen consumption in the brain. So kalamitan for mga ischemic stroke, we have citicoline, brand, cholinerve, Zynaps. Ischemic stroke, again, ischemic stroke, citicoline, brand, cholinerve, and Zynaps. Ay mong kalimot sa brands ha. Ay mong kalimot sa brands. Anticonvulsant, so we have levetiracetam, Keppra. So an adjunct therapy in the treatment of partial onset myoclonic or tonic-clonic seizures, so used to treat epilepsy. So again, usa gitong another brand ganiha nga pang anti-epileptic pod for generalized tonic-clonic. Unsa tong usa ganiha nga anticonvulsant? Katong niingon ko nga
Phenytoin, ma'am.
okay, very good. Phenytoin with the brand, say brand. The brand.
Dilantin.
Okay, very good. So, another anticonvulsant, phenytoin and dilantin. Then we have levetiracetam or Keppra, an anticonvulsant pod, SIA. So, anti-epileptic or treatment of epilepsy, we have levetiracetam. Then, hypnotic and sedatives, we have dexmedetomidine, HCl or the Presidex. So, si Aris, ano si Aris? Aris? That's Aris. That's Aris. Hi, your friend. Give before and or during the surgical procedures for patients under intensive medication or ICU patients. Again, key term for dexmedetomidine or the Presidex, kalamitan kunin siya ginagamit sa before and during the surgical procedures sa atong mga ICU nga patients. Kay mo ni siya, kay since it belongs to the classifications for hypnotic and sedatives. So for ICU patients gani, highlight Presidex. Okay, next. We have the antithrombotic. We have the soludixide or the Veselju. Potentiates the antithrombin 3 and heparin cofactor 2 due to the presence of both glycoaminoglycan fractions. So it is capable of inhibiting both the anti-2 and anti-10A. And it promotes the fibrinolytic activity by releasing the tissue plasminogen activator and reduces plasminogen activator inhibitor. So, antithrombotic, importante lang is ang classifications for soludixide, antithrombotic, Veselju. Drugs acting on the uterus, we have the isoxsuprine HCl or the brand isoxilan. So, I think discuss na po ni sa ato ang cabinet ni Ate Island, cabinet 1, 3, cabinet 3.
3, ma'am.
3 sa baba, okay, 3, isoxilan. So, tocolytic, the uterine hypermotility disorder such as threatened abortion and uncomplicated premature labor. So, muna siyang ginagamit sa isoxsuprine. So, an adjunct therapy in the treatment of peripheral vascular disease such as arteriosclerosis obliterans, thromboangiitis obliterans or the Buerger's disease, and the Raynaud's disease. So, for isoxsuprine, tocolytic or para siya sa fertility disorders such as threatened abortion and uncomplicated premature labor. So, basta drugs acting on the uterus, isoxsuprine, isoxilan, o sara na siya nga preparation sa ato sa ampules. Okay, next. We have analgesics. We have, for analgesics, specified niha na atay opioids and non-opioids. So for analgesics ng opioids, importante yung mahibalaan, tramadol. So si tramadol, under analgesics ng opioids, so we have tramal, peptrad, analgen, TDL. Again, tramadol for analgesics, opioids, tramadol, tramal, peptrad, analgen, and TDL. For analgesics nga non-opioids, we have paracetamol with the brand Naprex. So again, for analgesics na to, please, kanarag dito akong ipangayon ninyo, opioids and non-opioids. Si opioids, tramadol with the brands Tramal, Peptrad, Analgel, TDL. For non-opioids, we have paracetamol, Naprex. Okay? So that's sabotable na siya nga analgesics. and cold preparations, we have the N-acetylcysteine with the brand Fluimucil, so the mucolytic activity in respiratory disorders associated with productive cough. Again, N-acetylcysteine or the Fluimucil, mucolytic activity in the respiratory disorder. So aside from Fluimucil, unsa to ating other brand for N-acetylcysteine nga dili IVIM, we have unsa other brand? Naatay Explain. Very good.
Excellent.
So, mucolytic, Fluimucil. Sa emergency med, unsa to atong available nga cough and cold preparation? Para sa cough and cold, it is a bronchodilator. Unsa to gani? For cough and cold, we have
Aminosol, ma'am.
Okay, aminosol with generic nga aminophyllane. Very good, naminaw gid ay. So ana lang gid ha, ana lang gid na ako report para mas easier siya ninyong masabtan. Para dili na kayo daghan kayo information, mag-information overload na kayo mo sa mga iyahang mga definitions or unsa ba na nga mga kuan niya. Basta ana lang kabalo lang gid mo kung asa siya na bilong. Kay kabalo mo siya asa siya na bilong nga drug class, matik na ang kabalo mo nga para siya asa. Okay? Then we have the nootropics or the neurotropics. So for nootropics or neurotropics, we have mecobalamin with the brand Metecobal. So it is a naturally occurring vitamin B12 in the body. Highlight, naturally occurring vitamin B12 in the body. And it acts as a coenzyme of methionine synthetase in the transmission of the homocysteine and methionine for various metabolic functions that are essential in the cell replication and hematopoiesis. So again, a naturally occurring vitamin B12 in the body, we have the mecobalamin with the brand Metecobal. So na po tayo preparation ani nga tablet for cabinet ni Ma'am Jillian. Next, NSAIDs. What are the meaning NSAIDs? NSAID stands for
Non-steroidal anti-inflammatory.
Okay, very good. So non-steroidal anti-inflammatory drugs. So for our NSAIDs, kanina kita
Wala
mo
din mo
pangayon
ang
ninyo,
slide, ma'am.
ketorolac. Ay, wala ni mo ang slide. Kadali lang ha. Wala ko na akong signal. Kadali lang. Okay, kana. So for NSAIDs, kanina gid akong gipangayo ninyong kabalo mo asa siya nabilong. So for ketorolac, Dirolac, Ketomed, Cortisor, Torilac. Again, Ketorolac with the brands Dirolac, Ketomed, Cortisor, Torilac, non-selective COX inhibitor. Again, Dirolac, Ketomed, Cortisor, Torilac, non-selective COX inhibitor. For Paricoxib, Dynastat, COX-2, selective inhibitor. So again, Dirolac, Ketomed, Cortisor, Torilac, non-selective COX inhibitor. Paricoxib or the brand Dynastat, COX-2 selective inhibitor. Okay? Mura gina akong gipangayo sa inyong NSAID since discuss na ni siya na part with mga COX inhibition. I guess na-discuss na ni previously. So sa NSAIDs lang yun, non-selective o COX-2 selective ra gid akong gipangayo ninyo nga makahibalo mo kung unsa na sila. Okay? For our NSAIDs. Gets ragang?
Yes, ma'am.
Yes, ma'am.
Okay, very good. Okay, next slide. We have antiemetics. So ondansetron with the brand and stop. So selectively antagonizes the 5-HT3 receptor on both peripherally on vagal nerve terminals and centrally in the chemoreceptor trigger zone. So it works by blocking the action of the serotonin, a natural substance that may cause nausea and vomiting. So again, ondansetron antagonizes or selectively antagonizes the 5-HT3 receptor. Highlight, selectively antagonizes the 5-HT3 receptor on both peripherally and vagal nerve terminals. So ondansetron. So iyang i-block ang action sa imong serotonin, which a natural substance that may cause nausea and vomiting. Then we have the metoclopramide. We have Placil and Metvex nga brand. So gastrokinetic or prokinetic. So gastrokinetic or prokinetic, an antiemetic agent and D2 antagonist used in the treatment of gastroesophageal reflux disease or GERD, prevention of nausea and vomiting associated with chemotherapy, and to stimulate gastric emptying. Again, an antiemetic agent and D2 antagonist. D2 antagonist, Plasil Metvex, antagonizes the 5-HT3 receptor, stop, or ondansetron. Okay? Gets? Gets, Ra?
Yes, ma'am.
Okay, very good. Okay, so that ends my slides for our